All right. Well, good morning, everybody. Thank you so much for joining us this morning. And thank you, Jen, for that wonderful presentation on AAC. My name is Sara Warner. I am one of the clinical psychologists here at the Weissman Center. I work in two of our Weissman Center clinics. So I'm in the Autism and Developmental Disabilities Clinic doing diagnostic work, and also in the Autism Treatment Program doing more intervention-based work. This morning, I'm going to spend some time here talking about depression in the context of autism. So we know that depression is a significant mental health concern for many people, and that includes those in the autistic community. However, often depression is not recognized or might be overlooked for those in the autistic community. And my goal with today's talk is to discuss recognizing and treating depression for this population. We'll hopefully have time at the end for some questions. So as everyone has been doing, if you'd like to, feel free to type questions into the chat, and then I'll try to address as many of them as I can in the time that we have today. Otherwise, I know my email is up on the slide right now. If someone wants to add it to the chat, that'd be great too. And then I am happy to have people reach out to me afterwards, and I'm happy to talk more. So I probably am not going to be seeing the chat as I'm talking, so just to be aware of that. I like to make sure I'm not distracted too much while I'm talking. And then just two other things before I jump into things here. I am choosing to use identity first language as I'm talking today. My reason for that is that the research has shown that is the preference from the autistic community. I realize that is not everybody's preference, but that is just the reason that I am choosing to use the identity first language. And then lastly, just as an aside, as people are thinking of questions that they might want more information on or would like to ask, while I'm always encouraging of people thinking about this information and how it might impact them or those around them. Unfortunately, I'm not in a position in this presentation to be able to answer personal questions related to your mental health concerns that you might experience or have, or the mental health concerns of others you might know. So just so you know, as you're thinking of questions. All right. So let's keep going along here. So a brief overview of the topics I'm hoping to cover today. I want to start with a short discussion on prevalence, or how common depression and autism are in the population. And I'll then speak some towards the similarities and differences in the two diagnoses, difficulties in recognizing and diagnosing depression in autistic individuals, and then concluding with a discussion around treatment and interventions. And then, of course, questions as we have time for them at the end. So some quick information regarding prevalence. Prevalence refers to the total number of cases of a particular diagnosis in the population. It's often communicated as a percentage, or a percentage of the total population that's affected by a certain condition. I think something that's always important to keep in mind, in the back of our mind while we're thinking about prevalence rates, is that they're never going to be perfect. To get a perfect prevalence rate, we'd really need to be able to account for every single person in a given population, which is often pretty impossible to do with regard to any area that we might want to study. With that said, then prevalence rates may differ depending on where you're looking, what source you're looking at, how that particular group or organization got the numbers that they got, what methods they used. Now, all of this is not to say that prevalence rates are meaningless, or that they don't hold as much meaning as we think they should, but rather just that I think it's always important to be thinking critically about statistics that are being reported to us. So I have here the prevalence rates for autism and depression in children as reported by the Center for Disease Control, or the CDC, here in the States. So the prevalence of autism in the general population of children is currently understood to be around 2.2%. So in other words, 2.2% of children in the US population are thought to have autism. The prevalence rate for depression in children, as reported by the CDC, is at 3.1%. So in other words, 3.1% of children in the general population, and this would include autistic children, is thought to have depression. Now, in the middle here, I have a reported prevalence rate for the number of children who have already been diagnosed with autism and who also have depression. I will say when I was looking for this number, there was certainly variation between research studies about how prevalent depression is for autistic children based on how they collected that information. The particular study I have here looked at data from multiple other studies and was kind of bringing that all together and found that around 7.7% of autistic children also experience or meet that criteria for depression. So while this number does vary and might vary more than some of the other prevalence numbers that we were seeing here, based on kind of where you're looking or what research study you're looking at, I think the important takeaway from this is that the number generally tends to always be higher than the general population for general population prevalence for depression. So here we're seeing the general population prevalence for depression in children at 3.1%, and then the prevalence rate for specific to the autistic community for children specifically being almost twice that at 7.7%. So I think the major takeaway here is that we're consistently seeing that a higher proportion of autistic children are experiencing depression compared to children from the general population. All right. So here I have laid out the clinical criteria that psychologists or other health providers are generally looking at when deciding if somebody has a diagnosis of autism or depression, and this would be the same for adults and children. The main point I wanted to highlight here is how when we look at this written out, autism and depression sound like very different conditions, and it may not always be apparent at first from looking at the criteria in this way why these two diagnoses might either get confused or why someone might have trouble recognizing depression in autistic individuals. I often think it's more helpful to think about some of the broader similarities and differences between these two diagnoses to really get a better sense for that. So I'm going to move on to the next slide. So when we're looking a little bit more broadly, there are certainly still big differences between autism and depression, but there are also some important similarities that I want us to talk about and try to understand as well. So autism is often understood as a neurodevelopmental diagnosis, while depression is thought of more commonly as a mental health diagnosis, meaning that autism is understood to be a part of someone's neurological makeup, something that develops with them and is a part of them throughout their lifetime. Depression, on the other hand, is understood to be a mental health condition, something that they are not necessarily born with, that they may acquire or develop later in life. And further,
Sara,
depression.
I'm sorry to interrupt. I just have to have you slow down just to.
Oh, sorry.
For our translators.
Yep, I will. I was whole time in my head, I was like, talk slowly, but I'm still talking fast.
Okay, thank you.
Yes. All right. So depression is thought of as a mental health condition, not thought of as something that the individual is born with, but something that they may acquire or develop later in life. Further, depression is thought of as episodic. So while there are certainly those who experience depression as a chronic or potentially lifelong condition, for many, depression is something that is experienced in episodes or comes and goes, rather than being a constant in that person's life. And lastly, depression is generally a condition that is thought of as something to treat or get rid of, rather than being a part of that person's being or who they are. So those are some of the more broad differences, but there are also some more broad similarities that I also want to highlight between these two diagnoses. And the and I feel that these two similarities here, so I have them listed here, behavioral and that they impact perception, often contribute to some of the difficulty in recognizing or why depression might go overlooked for autistic individuals. So the first being that both diagnoses are considered behavioral diagnoses. And what I mean by this is that both of these conditions are diagnosed based on what is being reported, either directly by the impacted individual or by somebody close to them, and by clinical observations of that person by the clinician. At this time, at least, there are no, we don't have any blood tests or any type of medical or lab tests that can be done to say from an objective standpoint that someone has depression or autism. Therefore, there certainly can be a level of subjectivity to identifying these conditions. Additionally, both of these conditions will have some impact on how the person perceives and understands their world and the information coming to them, as well as how they're experiencing their world. And this can certainly in turn impact what that person may be expressing towards others close to them, or medical, or certainly medical professionals as well. And autism and depression also can impact how others are viewing that person. So I want to go a little bit deeper now and talk about why the fact that autism and depression are behavioral diagnoses and that they can impact perception, why this contributes to this difficulty in recognizing and diagnosing depression in autistic individuals. So first, what depression looks like or how it presents can be very different for autistic individuals versus neurotypical individuals. So I'm going to jump forward to the next slide quickly, and I'll come back to this one in just a second. And I realize this slide may be a bit hard to read. It has a lot of text on it, but I wanted to show this graphic. It's from a specific study. I have it listed there at the bottom, as it outlines nicely how there are different depression symptoms that may be more telling to look for in the autistic community, rather than the prototypical signs of depression that we often think about. So some of the symptoms listed here on the left are the typical signs of depression that might be looked for both in and outside of the medical or mental health community. They can include things certainly like depressed mood, hopelessness, changes in sleep or appetite, low motivation or concentration, or thoughts of death or suicide. And these are considered some of those prototypical signs or symptoms of depression, as they're also the criteria for depression that I showed a little bit earlier. However, while this may or may not be the case for autistic individuals who are experiencing depression, autistic people may not be reporting these symptoms in this way, or may not be showing these symptoms in the way that providers might typically be looking for them. And so that really goes back to this idea that the observable signs of depression can often look different for autistic individuals. On the right side here, we have a list of depression symptoms that are thought to be more specific and sensitive to those in the autistic community. And I will read these ones off just in case you're not able to read the slide as well, as I think they're important to hear. So on the right side here, we have increased irritability. We have changes in circumscribed interests, and what that is referring to is the tendency for those in the autistic community to have more restricted or fixated areas of interest. And we might see a decreased pleasure or enjoyment in those areas. We might see an increased intensity in those specific interests, or we may see a change in the content of those interests to something that might be darker or more morbid in content. We then also may see increases in repetitive behaviors. We might see increased anxiety or insistence on sameness. So that's referring to some of the more rigid or inflexible behavioral tendencies that autistic individuals can or may show. Increases in aggression or self-injury, regressive behavior, or a decline in self-care. So the two things I find most striking here in terms of depression, signs or symptoms of depression that may be more specific to autism, is that none of these are specifically the signs or symptoms of depression that are laid out by the criteria for depression. And in fact, many of these are signs or symptoms that are actually included in the diagnostic criteria for autism. So I think I'm hoping it's starting to become a little bit clearer or understandable why depression either may not be recognized or may go overlooked in this population. So I'm going to jump back to the previous slide here. And this kind of all feeds into the second difficulty that's listed here, that autism features can mask depression symptoms or be misinterpreted as related to autism rather than a separate diagnosis of depression. And this further connects back to the idea that both autism and depression can impact perception and can muddy the waters when trying to understand if somebody meets criteria for both of these conditions. Lastly, the last one here, I just wanted to touch on briefly. It's a little bit different from the last 2 points that I was talking about, but there is a lack of assessment tools appropriate to this population. So I know I said earlier that we don't have any truly objective medical or lab tests that can test for depression or test for autism. But as a field, we have tried to come up with assessment tools that can be used to help make the process somewhat more objective for us. With regard to depression, usually this is in the form of behavioral questionnaires that either the person themselves will fill out or potentially somebody close to them, a caregiver, a teacher, another community provider might fill out. And when these have been developed, they're usually always been developed based on neurotypical development and a neurotypical understanding or presentation of depression. So with that in mind, we always want to be cautious when looking at the results from these types of assessment tools. I think they certainly can still be useful and provide helpful information, but we do want to be cautious because there is certainly the possibility that the results from these types of tools may not be accurate or entirely valid for autistic individuals. All right, I'm going to keep us moving along because I think, almost at 20 minutes and have a couple more slides. So my main takeaway when thinking about how to recognize depression in autistic children or adults is to be aware that the signs of depression may look different for this population, and also to focus on what has changed or what is different. So if we're thinking about depression as something that usually develops at a particular time point in someone's life, rather than being something that is kind of constantly there, then if somebody is experiencing depression, there should be some expression whether from the person themselves or from others close to them, of some type of change from baseline. And so we really want to focus on what that difference or what that change is, and then really work to be understanding how best to interpret those differences. Then the last point I want to talk about here, and then hopefully if I didn't take up too much time talking myself, we'll have time for a couple questions. Otherwise, as I said, please feel free to email me and I can respond that way as well. But I want to touch a little bit here on treatment and intervention. There's usually two main pathways for treatment when we're thinking about depression. One is medications. I have antidepressants listed here. Really beyond that, I'm not going to be saying much about medications. It's not my area of expertise, but I always like to make sure when we're talking about intervention for depression that it's listed as a possible treatment option, as it's certainly a valid and available treatment option if people are interested in it. But what I'm going to be focusing a little bit more on here briefly is therapeutic interventions for depression. So there are many different programs and interventions that have been developed over the years to help treat depression, both for adults and children. Because there are so many, I'm going to talk a little bit more broadly about intervention rather than focus in on any one specific one, with my main goal for this last part of the talk really being to share some of the general ideas behind some of these interventions, and then discussing some important factors to consider or to keep in mind when approaching treating depression in autistic people. So the first thing that I think is most important to think about when thinking about depression interventions for autistic people is that, by and large, depression interventions have been developed and researched based on a neurotypical population. So this isn't to say that we should automatically discount them for the autistic community, but that it is an important factor to be aware of and to be considering when choosing or implementing any specific interventions. So there has certainly been some research done on therapeutic interventions for depression in the autistic population, but this is much more limited, and it's often also specific to depression in adults rather than children or adolescents. So in my view, I think the most important factor when autistic individuals are seeking depression intervention is ensuring that the provider you're working with is familiar with autism and how this can impact the signs, the symptoms, and interventions for depression. Because most, if not all, interventions for depression have been developed based on neurotypical functioning, there are often adaptations or modifications to intervention that may be needed in order to help optimize their usefulness for this population. And without that working background knowledge of autism, this might be more difficult to do, as well as might just get overlooked as something that would be helpful to do or that is needed. Now, with that being said, I also think it's important to note that not every intervention for depression is going to be helpful or work for everyone, neurotypical or otherwise. So while we want to be cautious and aware of adaptations that may be needed for autistic individuals, likewise, we also do not want to automatically assume that any and every difficulty a person might be experiencing or having with an intervention process is directly related to their autism diagnosis. So I have listed here a couple of common intervention modalities that are used to treat depression. I'll talk very briefly about them, and then again, hopefully have some time for questions. So cognitive behavioral therapy, or CBT, it's a broad term for different interventions that rely on challenging negative cognitive thoughts and maladaptive behaviors that are thought to be perpetuating depression symptoms. And there are many, many different interventions out there that kind of work from this approach or this perspective. Broadly speaking, mindfulness is a type of intervention that focuses on being present-centered and accepting our thoughts in an open and non-judgmental way to help bring our awareness to how our thoughts, feelings, and actions may be interfering with our life. And again, maybe perpetuating those depressive feelings or symptoms that we might be having. Both of these approaches have been shown to have a positive impact on those with depression, and there is some limited research showing their effectiveness for autistic individuals as well. And then lastly here, social skills or vocational training are intervention approaches that are often more common to treating depression within the autistic community. Here, what the research is showing is that, while these types of approaches, they're not directly targeting or addressing the symptoms of depression, that research has shown that depression can often come about in the autistic community due to difficulties or concerns people are having with their interpersonal social relationships or their professional lives. And therefore, additional skills training in these areas can often impact their experience of depression as well. So I do have one more slide here. It's a graphic that goes a little bit deeper into some of the intervention strategies related to depression. I'm not going to spend too much time here because I want to see if we still have some time for questions, but it sounds like the PowerPoint slides are going to be made available so that hopefully you all can take a little bit closer look at this if you're interested. So thank you so much for joining this morning, and I will stop talking now.
Thank you, Sarah. We do have some questions that came in to the chat. One of them is, are there psychologists or therapists specializing in children with special needs?
Yeah, sorry. Now I'm looking at how to stop sharing my screen, but I did hear the question. Yes, there certainly are. I will be honest, it certainly can be a little bit harder or fewer to come by, but there definitely are those in the community. So I think if you wanted to reach out to me via email, I might be able to go into a little bit more detail or give some more specific resources for places to look for in our community here in the Madison area, if that's what you're looking for.
Okay. Another question is, does a genetic predisposition relate to depression? And if so, does this relate to how screening should be done for autistic people with depression in their family history?
That's an excellent question. I will start by saying that I am certainly not an expert in the area of genetics. But we certainly know that family history, or if there is a family history specific to mental health concerns or depression or anxiety, can put the person themselves at a higher risk for developing depression or other mood or mental health based concerns or difficulties in their own life. I don't know if there's any specific genetic testing or genetic screening that's available. I think that's a wonderful question that I just don't have the information to answer. But I think it's wonderful information to be thinking about and being aware of as you're thinking about somebody's mental health or your own mental health.
And then please comment on the relationship, the interaction or influence of anxiety and depression.
Yes. So anxiety and depression do often go hand in hand. So I know I kept this talk specific to depression, but often, I do think that it can be difficult to talk about one without the other, because there is a very high number of those that experience depression who also experience anxiety, and vice versa. So I think going into the larger relationship between them might be a bit more than we have time for right this moment. But again, if you'd like to email me, I'm happy to follow up more. But I think it's absolutely very important to understand that those two are very related. I often will talk about them as if they're cousins of each other, that, they often present together, and it can sometimes be hard to separate the two. And also, and often some of the different interventions, both from a medication standpoint as well as a therapeutic standpoint for depression and anxiety, a lot of times they might look similar as well. Sorry, I'm not sure if that answered the question super thoroughly, but.
No, thank you, Sarah. And there may be some, if you have an opportunity to during the community panel, there may be some additional questions in the chat.
Yeah, absolutely.
Good. Well, thank you so much.